Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another edition of Boomer Health at Home. I'm your host, Ryan Donlin. Today we're going to discuss a microscopic being that has the ability to strike fear in all of humanity. I'm talking about the influenza virus, of course. And joining to me today is to offer an expert's point of view is RN and infusion specialist for AmeriCare Medical, Janet Alderman.
Hi Ryan, how are you?
Good, thank you for being here today.
Thanks for having me.
So it's a pleasure having you. So now you hear a lot of talk about the flu being a seasonal threat. Mm-hmm. So what is that true, first of all, and what exactly is the flu season?
The flu season basically starts in October. You can be more susceptible to being exposed to it, and it usually goes through January and February until like really when the big frost and everything freezes.
Oh, is there a time during the season where the flu is more prevalent, or?
Nope, it just really can happen anytime during that time.
Great. So why is that? Why during the winter time? They seem like you'd be avoiding everyone, staying out of the cold, but...
Well, the flu virus is comes into our respiratory system, and it's from exposure and things like contaminated surfaces like shopping malls, and you're more enclosed during those time of the year. In the fall, you start shutting the windows and the exposure is greater, and you're probably exposed to more people in the office that have that flu.
That makes sense, yeah. Now, I know when I get sick, the first thing I like to do is try to retrace my steps to really pinpoint exactly when and how I contacted the virus, mostly to find out who gave it to me to make them feel a little guilty about it. But now, exactly how do you contract the flu, and when is someone most contagious if they do have it?
That's the problem, because most people are contagious the day before they even start having symptoms. Oh. So they might not even know that they have the flu. And like I said before, it's contracted through coughing and sneezing, and that respiratory droplets are on any kind of surface. So if you don't wash your hands properly, and there's different things that you can do to prevent it, you're more exposed to that.
So you really don't know, it could be anyone.
So it could be anyone, yep. And then you're usually most contagious the day before, and then 5 to 7 days after contracting it.
Oh, wow, okay. The flu, what are symptoms? How do you know if you do have the flu?
Well, usually fever is a big one. Fever, chills, body aches. It's different than, you still have the runny nose, sneezing, cough, but that's different than the cold. Because usually with a cold, you don't run a fever.
Right. And
then have the chills and stuff. Headache is a big symptom of it also.
Sure, and a common thing I see in office and stuff, someone who has a flu is always say, no, it's just food poisoning, I'm okay. Is there a distinguishable difference between influenza and food poisoning, or?
Well, that's a good thing. A lot of times people think that the flu is when they have that GI upset, but that's really more of a different gastrointestinal flu, is different than the respiratory flu that we get a vaccination for.
Great. So speaking of vaccinations, what do you recommend people do to prevent themselves from getting the flu?
Well, first of all, the big thing is just washing your hands, keeping everything clean, avoiding people who are sick. If you know they are sick, if you become sick, stay away from your loved ones. Don't be passing that around to everyone. Rest at home, that kind of stuff. There are vaccines against the flu, and I would really recommend that anyone that has like your immune system is compromised, your elderly, healthcare workers that you're exposed to, or if you're exposed to a lot of little kids, definitely get the flu vaccine.
Now I know there are different types of flu vaccinations. Do they work, and could you give us a little more information as to what types are available?
Yes, the most common vaccine that is given out there in the flu clinics is the one that has the 3 components. It has 1 of the type B viruses and 2 of the type A. There is one out there that will cover 4 components, 2 type B and 2 type A. And it just, people that maybe are more susceptible should get the one that covers 4 components.
Very good. Now, are these all shots then, or is there nasal sprays available?
There is a nasal spray, but they're not recommending it for 2016 to 2017. They're not saying that it's as effective. They thought maybe it was, but it's not really. Yeah.
Okay. So who would you recommend? Who should get vaccinated?
Any healthcare worker should get, anyone that's around small children that might be exposed to it, anyone whose immune system is compromised, maybe you have going through chemo, radiation, you have diabetes, somewhere where if you got the flu and it would make you at risk for some of the more serious side effects. Because most of the time, flu itself, if you have a good immune system, you can get through it. But if you have anything else and you get the other things like pneumonia or sepsis or anything, that's the part that causes the problem.
Okay. All right, so let's say you do everything you can. You're washing your hands, do everything you said, but inevitably you still get the flu. What do you recommend at that point as far as home remedies go, or ways to help yourself if this is?
Yeah, the big one is taking Tylenol for the fever, really controlling the symptoms you're having. So if you have fever and chills, Tylenol, Motrin will help for that. Drinking plenty of fluids. You usually get dehydrated during that. When you have a fever, you tend to get dehydrated, so lots of fluids. You have respiratory symptoms like runny nose, or you're congested, so do like the hot shower where you get really steamy, get that congestion out. Anything you can do to thin the secretions so you can get that virus out of your system, the faster, the better.
Okay.
Really warm compresses to your head if you have a headache. You can use cough drops for the sore throat. Honey, tea and honey is always good. You know, old home remedies that your grandma used to do.
Oh yeah. How long do the symptoms typically last? Does it kind of vary, or?
It usually is 5 to 7 days. If it's going past that time and it's been 7 days and you're still having the symptoms, then you want to seek treatment from your doctor.
Okay. What are risks if you left? I'm sure influenza, if left untreated, there's probably additional risks you take on. Can you talk a little more about that? Or?
Well, that's where you get into things like sepsis, which gets in your blood, and you can have full-blown infection in your blood. It can go in your lungs. You can get pneumonia, those kind of things, and that's what causes the real problem with the flu.
Well, that's all the time we have for today. But Jan, it's really been a pleasure having you. Thank you for taking the time to come out.
Thank you.
Now, if anyone has any additional questions, is there a number they could call to?
Yes, they can contact any of the nurses at Ameristaff at 248-288-2270. We're happy to answer any of those questions.
Well, I hope you enjoyed this segment of Boomer Health at Home. Thank you for watching, and of course, wash your hands and stay healthy, Michigan.